Good afternoon. So, in today's lecture, we are going to discuss about a specific case. So, the information related to that case is given here. First, we need to read the case properly. Then, we will try to solve all those questions related to this case. First, read out the case properly. So, here it is mentioned a 28 years old woman comes to the outpatient clinic with some complaints of fatigue, dizziness, and shortness of breath on exertions for the past 2 months. She also mentions a paleness of skin and brittle nails. Her diet is mostly vegetarian, and she also reports menstrual blood loss lasting 7 to 8 days in every cycle. On examination, her conjunctiva is pale and her pulse is 96 per minute. Laboratory investigation shows hemoglobin level 8 gram per deciliter. MCV is below normal. MCH is below normal. And peripheral blood smear shows the microcytic and hypochromic RBCs. So these cases are divided into 3 parts. Now we will try to understand how all these informations are important for the provisional diagnosis of this condition. So according to the case, the first line it was mentioned the complaining of fatigue, dizziness, and shortness of breath, right? In second part, it also shows some features like paleness of skin and brittleness. If you see the biochemical features, like the hemoglobin level is below normal. The mean corpuscular volumes as well as mean corpuscular hemoglobin is also less than normal. If you see the patterns of the blood cells, like the microcytic, which is not normal size, less than normal size, right? At the same time, it is hypochromic RBCs, means the RBC doesn't contain the sufficient amount of hemoglobin. That is why it is called hypochromic. Now, based on the informations, what is your provisional diagnosis? Based on the informations, what is your provisional diagnosis? What? Jaundice, okay. Jaundice, okay. No idea? No issue? Anemia? You? Anemia. You? Anemia. Now, let me ask you, why it is jaundice? Paleness of skin. Okay. So, other than these features that is given in this case, there are many other informations. You are not using other informations for provisional diagnosis, no? Only you are using these features. Hana? Okay. Anemia. Why? What is MCV? What is MCV? No idea. No issue. So what does it mean?
RBC volume.
RBC volume? Red cell volume. So red cell volume is not normal, less than normal. Now can you justify why it is called anemia?
Sir, because the blood is decreasing
Because blood is
like decreasing from the body and like
blood is decreasing from the body.
blood loss is happening.
Blood loss is happening. Okay. What is your justifications? Why? Blood is lower than normal. Why it is given? Hemoglobin is lower than normal. Okay. Anything else? Okay. Now let me explain. Yes, you are a little bit correct. Now see what is our provisional diagnosis. It is anemia. It is a type of anemia. What type? Now, why it is called iron deficiency? Why? Hemoglobin. So what?
That's why iron level is also less.
That's why
Hemoglobin is
Diet. There is a low amount of iron in the diet.
there is low amount of.
Iron in the diet.
So the person is taking the diets from vegetarian source, no? So
It's low. Vegetarian source में कम रहता है iron इसलिए.
वेजिटेरियन सोर्स में
Iron कम रहता है.
आयरन कम रहते हैं. ओके. और कुछ ऐड करोगे? और कुछ ऐड करोगे? Okay. Now let me explain the justification parts. So it is iron deficiency anemia. This is a provisional diagnosis. Now let me explain in detail. So according to the informations given in the case, it shows the cell type is microcytic. The volume is not normal. It is less than normal. And it is hypochromic RBCs. It means the cells doesn't contain sufficient amount of hemoglobin. Okay, that is why it is called hypochromic. Now at the same time, in the case it was given the hemoglobin's level is below normals and mean corpuscular volume that was given in the case that was also below a normal. So along with this, you also can see the value of MCH that was also not normal. So what?
MCH.
MCH mean corpuscular hemoglobin, that is the percentage of hemoglobin presence in an RBC. Clear? So that is also normal. So all these characteristics like microcytic, means cell size is less, the volume of the cells is less, not normal, and it is hypochromic RBC, as well as the MCV and MC's percentage is also not normal. All these criteria actually meets about the deficiency of a specific type of micronutrient, that is the iron. Clear? Now along with this, what we have seen, the level of blood hemoglobin is also below normal. Now another important information that we can use for the provisional diagnosis purpose about the dietary patterns. If you see the most important sources of iron, the most important sources of irons are animal sources. So animals, means irons, which are which are providing from animals, they are easily observable, right? In comparison to irons coming from plant sources. So as the absorption patterns is less for plants irons, so body will not get sufficient amount of iron. That is one point why we can say the subjects may have the deficiency of iron. Clear? Now another important point given here, the person's age. The person is in a particular age group, that is in reproductive age group, right? So what we have seen here in this case, there is a persistent menstrual bleeding, right, which lasts for 7 to 8 days. So means blood loss हो रहा है. So due to that blood loss, there is a high chances of the loss of iron too. So body iron deficiency में suffer कर सकते हैं. Clear? Now, so now you can see the the physiological explanations that is mentioned here. This is the normal range of MCV for healthy person, that is around 80 to 100 FL. But in our case, here it is less than that. Clear? Now, as the MCV level is below normals, how it is physiologically related? You can see here, when hemoglobin synthesis is reduced, the developing red blood cells in bone marrow cannot accumulate normal amounts of hemoglobin, obviously. So we know the most important site for the synthesis of blood hemoglobin is the bone marrow, right? But here persons are having the deficiency of iron, क्योंकि blood loss भी हो रहा है. The most important sources of that irons for that particular subject is plant source, and another important part is the size of the RBC is not, or volume of the RBC is not normal. So all these things actually indicates the synthesis of RBC are not normal, it is reduced, right? So as the hemoglobin synthesis is reduced, obviously the person's blood contains the less amount of blood hemoglobin, so that information is given in the case, right? So as it is reduced, so that is why there is a changes in the cell type or volume of the cell, which is microcytic, and that is why it is hypochromic, because the hemoglobin content in the blood cells is less. Now, in this questions, it is asked, what is the physiological justifications for these findings? हम लोग already बोला कि yes, it may be the case may be the iron deficiency anemia. So, what would be the proper justifications against this? जैसे कि there are mainly 3 or 4 different factors that can be correlated with the provisional diagnosis, like जैसे कि the synthesis of RBCs, or it is a decreased amount of RBC synthesis, that is why it is microcytic, and the concentrations of hemoglobins per RBC cell, it is also reduced. Another important part, as we know, the hemoglobin is very vital for the cell, for the body. Why? Because it carries the oxygen, right? And that oxygens are delivered to the tissue or cells. So for the proper performance of that particular cells or tissues, they need a sufficient supply of oxygen. But here, in this particular case, subjects are having less hemoglobin. So less hemoglobin होने की वजह से क्या होगा? The oxygen carrying capacity of the blood will be less, है ना? So oxygen carrying capacity कम होगा तो so tissue will suffer with the oxygen deprivation. So हम लोग केस में देखा था ये subjects are having some symptoms like fatigue. So क्यों fatigue हो रहे थे? क्योंकि the tissues or cells are not getting sufficient amount of oxygen. और क्यों oxygen नहीं मिल रहा है? This is due to the insufficient amount of hemoglobin. So insufficient hemoglobin क्यों है? क्योंकि subjects का blood loss हो रहे थे. At the same time, the sources of that hemoglobin is a vegetarian source. ये भी एक है. और भी other factors related with this. So हम इसको ऐसे बोल सकते हैं कि oxygen carrying capacity of the blood is reduced, leading to the tissue hypoxia. As a result, the patient experiences fatigue, weakness, and dyspnea on exertions because less oxygen is delivered to the muscles as well as the vital organs. ठीक है? Now the thing is clear. Now see, इसमें पूछ रहे हैं what could be the probable cause in this case? बात एक ही है, iron deficiency anemia तो बोल रहा हूँ. So what would be the probable cause? dietary intake, chronic blood loss, and the physiological demand of oxygen or iron, at the same time malabsorptions. Now see, in the first case, as we have already mentioned, that is the person is vegetarian. It means in comparison to heme contents in vegetarian diets, non-heme irons is much more, right? But for the formations of blood hemoglobin, the heme contents is very vital. So, but here it is non-heme irons. So, this is one point why there is a reduced level of iron, why there is a less synthesis of blood hemoglobin. Clear? At the same time, about the patterns of absorption. So, मैंने बोला, say in this particular case, the absorption rate or iron absorption will be less. Another important point we have already mentioned, that is the blood loss or persistent blood loss for 7 to 8 days in every menstrual cycle. So, and that also affects the overall iron content in the body, and ultimately it will affect the synthesis of blood hemoglobin. And another important point is increased physiological demand. Yes, during that particular phase or during pregnancy or in reproductive age, the requirements of that particular micronutrient is very vital, as the demand is also very high. But here in this particular case, though the demand is very high, but the supply is not sufficient. That is again another important point for the development of a case called anemia. And another important point is sometimes due to some other infections, it also affects the absorptions of iron, right? So here, like hookworm infections, that can reduce the iron absorptions. So ultimately, as there is a less absorptions of irons, it will affects the, it will facilitate the developments of conditions called iron deficiency anemia. Now, up to this, what we have mentioned, mainly 3 to 4 factors we have used for the physiological explanations against the diagnosis. The first one was the blood loss, second one was less amount of hemoglobin synthesis, third was the sources of the iron. Okay? Now, you also can correlate all those clinical features with the physiological basis. जैसे कि मैंने बोला, in the case it was given the body colors was changed, mainly skin color. So why there is a changes in the skin color? It is due to decreased oxyhemoglobin content. Decreased oxyhemoglobin content. What does it mean? So, what do you mean by oxyhemoglobin content? Oxygen that binds with the hemoglobin. Oxyhemoglobin content. So, in this case, the level of oxyhemoglobin content should be more or less reduced. So, here, as there is a reduced amount of oxyhemoglobin content, means the concentrations of hemoglobin is less, as well as there is a less amount of oxygen bind with this. So that is one main reasons of the changes in the color, right? Now इसके बारे में हम लोग already चर्चा किया कि क्यों fatigue और weakness हो रहा है, क्योंकि tissues are not getting sufficient oxygen. इसके बारे में बोला कि the breathing rate is changed. So why? So you can see tissues are not getting oxygen, means tissues are suffering with the hypoxia, है ना? So that particular conditions act as a stimulus, right? That will stimulate a specific respiratory center presence into the brain, right? So once that respiratory centers get stimulated, that will alter the breathing rate here. That is why there is a dyspnea on exertion. And brittle nails is another important features in this case. Why this features comes? That is due to the deficiency of irons in a particular site. Mainly, it affects the keratin that is present in the nail. And dizziness and headache, another important features, and that is also due to the reduced level of oxygen, mainly to the cerebral circulation. Now, in these particular conditions, we have a compensatory mechanism, and due to that compensatory mechanisms, we can see some other changes like tachycardia. So that is the abnormal first heart rate. So that is actually a compensatory mechanisms that maintains actually the sufficient amount of oxygen at the tissue level or at the cellular level. Now, what about the most important informations that we are used for the provisional diagnosis? Is it sufficient for the final diagnosis or not? इसके आधार पर हम लोग बोल सकते कि yes, this is iron deficiency anemia. बोल सकते हैं? So now question is, what are the tests that is used for the confirmation? Stool test. स्टूल में कैसे करोगे? ओके, और कुछ? और कुछ दिमाग में आ रहा है? हीमोग्लोबिन कम है, एमसीबी कम है, एमसीएच कम है, वेजिटेरियन सोर्सेस है, ब्लड लॉस हो रहा है, सब कुछ फैटिग भी है, सब कुछ इंडिकेट कर रहा है. सो वेदर this amount of information is sufficient for the diagnosis, or what are the other tests that we need to perform? See. Now see, what further investigations are required? That is the question. Yes, for the proper investigations, we can depend on some other tests that are very vital for the iron deficiency anemia, like the estimation of serum ferritin. Now question is, what is that serum ferritin and what is the rule of that serum ferritin here? To confirm the diagnosis of iron deficiency anemia and identify its underlying cause, several investigations are essential, and here it is serum ferritin estimations. And that serum ferritin is the most reliable test for assessing iron store. The estimation of serum ferritins actually act as a reliable test, and that test is used to assess the iron stores, right? So it is usually decreased in iron deficiency anemia. Now we'll see how this serum ferritin actually helps in the storage of iron. ये जो serum ferritins or ferritins, it is nothing. It is basically a type of protein, and that protein has some specific features that helps in the storage of ions inside the cell. Now, if you estimate the serum ferritins in a subjects who are having these conditions like iron deficiency anemia, in that particular subject, whether level of serum ferritin should be more or high. यहाँ पर बोलते हैं serum ferritin estimates, I mean it is the most reliable test for what? For assessing the iron store, right? So iron है तो मैं deficient नहीं बोल सकता, iron नहीं है तभी बोल सकता हूँ iron deficient, ठीक है? So whether persons are having iron deficiency or not, for that we depends on a specific parameters, that is the estimation of serum ferritins. Why serum ferritins? Because ferritins is a reliable source because it stores the irons at the cell level or cellular level, right? A small amount of ferritin is also released into the blood plasma, and this serum ferritin levels directly reflects the amount of stored iron in the body. So जिसका जिसका deficiency है, anemic तो है, if it is iron deficiency, तो serum ferritin का level कम होगा. So serum iron levels are also reduced, and it's indicating diminished circulating iron available for hemoglobin synthesis. Obviously, stored iron नहीं है. Iron is very vital for the synthesis of blood hemoglobin. इसलिए तो persons का hemoglobin level कम है ना? So एक दूसरे के साथ linked है कि serum ferritins is reduced. It means the stored iron levels is less. Stored iron levels is less means the synthesis of blood hemoglobins will be less. That is reflected in the case. Now another important parameters that are also used for the diagnosis purpose, that is called total iron binding capacity or TIBC. The total iron binding capacity is increased. Why? Because the liver produces more transferrin to capture the limited available iron. यहाँ पर दो चीज मेंशन किया. One is total iron binding capacity or TIBC, and another one is transferrin. So first you see about the transferrin. Actually, transferrin is a protein, and what is the other features of that transferrin? The transferrins act as a protein which has a specific binding site for iron, right? यहाँ पर बोलते हैं कि those who are suffering with the iron deficiency anemia, in their case, the iron binding capacity is increased. Iron binding capacity is increased, but if you see the features of the transferrin here, transferrin saturation percentage is low. What does it mean? Hemoglobin कम है, so hemoglobin कम है means, or synthesis of hemoglobin is less means the iron level is less. Iron किसके साथ bind करता है यहाँ पर? With the transferrin. Suppose this is a transferrin protein and it has a specific binding site for iron, right? So if all the binding sites of that transferrin proteins are occupied by irons, it will reflect that transferrin proteins is fully saturated. Percentage saturation is 100%, but here hemoglobin is less in the person. So iron levels also will be less. So whether the transferrin percentage saturations will be 100% or less than that. Less than that. It means if the person is anemic, the transferrin percentage saturations also will be less. So this is again another important marker that are used for the diagnosis of iron deficiency anemia. So these are most important indicators that are generally used for the diagnosis of anemic condition. Okay, thank you.